Hi everyone, this is Steven. So I'm owner of 40 Fit Club, a certified personal trainer, and I'm also going to be a certified surgical technologist. We're talking about today is that mental health care is a very important issue for a lot of healthcare workers because people sometimes we get overworked. Sometimes I could have like up to almost over 10 patients. In some cases, I used to work at certain facilities, I'd have up over 30 patients. So healthcare is actually is a very important topic. So I'm going to share some articles and some tidbits on mental health care issues for healthcare workers. Okay, for Oregon Nurses Association, these are some really great mental health care resources. We are in the state of an unprecedented struggle for healthcare professionals, especially in the state of Oregon. That the well-being of our direct care staff is essential to the health of all Oregonians. Frontline caregivers do not create this healthcare system, but they are carrying the burden of holding it together, which is causing significant mental and physical fatigue. Here's some mental health care resources. Nurse Assistance Network supports nurses who are experiencing substance disorder and or mental health care issues that are wanting to talk with someone about resources. They can call 1-888 516-2796 or talk with a nurse on ONA staff. The Oregon Wellness Program often accesses complimentary mental support that is non-reported, urgent, and urgently available to all various types of healthcare professionals in Oregon. This is another thing this is suicide prevention resources. The ANA, that's the American Nurse Association, suicide prevention is the resources page for general information on mental health promotion and suicide awareness. Suicide Bereavement Support is an Oregon based organization that provides group support services to those who've had lost a loved one to suicide. Sorry for dropping conversation for a second, but just wait for the page to load. Here's some more mental health nurse wellness from the Oregon State Board of Nursing. Working in nursing is very much rewarding, but it's also very, very stressful. And they're in the state of Oregon that there is therapy available. Or their Oregon Wellness Program. It's a free wellness support program for all Oregon providers and people and healthcare professionals working in Oregon. The Emotional PPE Project is a free service that connects healthcare professionals with licensed mental health specialists. Therapy Aid Coalition, free online therapy sessions for frontline healthcare professionals. Those would be your nurses, your CNAs, your doctors, anyone who's working in the hospital. There is a really lot of great resources out over there for healthcare professionals. Here's some common things that might look for to yourself. Number one, do you ever find it difficult for doing simple things like your everyday things, like getting up out of bed, going to the gym, trying to get yourself to work? Do you ever find that difficulty? Because then, if those are find difficult, or you find those difficult, then it's a little bit of burnout. Number two, have this is just have to check with yourself with this one. Have you ever find yourself ever getting like or being like really nasty to some people? Because sometimes that's actually a change. According to the Oregon Capital, the Capital Chronicle, which is one of Salem's newspapers, the Trump GOP budget's a dire threat to Oregon's patients, hospital nurses. Healthcare workers are warning of dangerous conditions in hospitals for patients, nurses, like under the new law. This is from Tammy Kine. She's the president of the Oregon State Nurse Association. Has spent 22 years working as a nurse at the Good Shepherd's Medical Center in Hermiston. Good Shepherd's is one of the more than 700 rural hospitals across the country at risk of closure because of the newly passed GOP budget. To cut trillions in taxes for corporations and the wealthy, the so called Beautiful Bill slashes federal Medicaid funding by more than $1 trillion over 10 years and is predicted to leave up to 17 million Americans without health insurance. That's a huge threat to patients as well as their hospitals, especially rural hospitals that rely heavily on Medicare payments. This also puts frontline healthcare workers like Klein with increasingly dangerous and unsafe working conditions. In Oregon, 1 in 3 people rely on the state's Medicaid program, the Oregon Health Plan. Under the new GOP law, an estimated 200,000 Oregonians stand to lose that insurance, putting patients and providers alike in danger. Rural communities are vulnerable to these cuts. Nearly half, that's about 44% of rural community hospitals in the United States, have already experienced severe financial strain this year alone. 16 rural hospitals shut their doors due to financial losses issues. Medicaid has often been a lifeline helping to keep rural hospitals afloat. But when coverage is stripped away and thousands of patients get uninsured, hospitals are left to cover the cost of uncompensated care. More uncompensated care will lead to hospital closures or service reductions, causing more frequent and severe medical emergencies as patients are forced to navigate long travel times, overcrowded ERs, chronic staffing shortages, and barriers to preventative care. Miss Klein also knows how this could play out. She told the Chronicle about this part. But this is a very interesting article. That's why I'm reading it to y'all. Patients who come in with an easily treatable diabetic foot ulcer because they were unable to afford medication follow up visits, the patient's leg had to later be amputated. Nurses are already seeing people suffer. Klein said Medicaid cuts are going to make patients sicker and sicker and sicker and throws nurses back into what they did during COVID. Since the pandemic since the pandemic, ONA's President Klein has outspoken about the severe rates of burnout, depression amongst nurses. Studies show that strenuous working conditions and chronic emotional laboring lead to serious mental health issues for frontline nurses and frontline CNAs also. Coupled with rising mental health issues, nurses are also experiencing unprecedented rates of workplace violence. In one survey, 92% of all nurses in Oregon Nurses Association Union report experiencing violence in the workplace this last year. Nationally, from 2007 to 2022, hospital staff saw a 1 to 8% rise in workplace violence and injuries. Nurses are being punched, kicked, thrown against walls because of impatience and stress, says Klein. No one's protecting us. We're just getting more volatile. Now, under this GOP bill, I envision with Klein also workplace violence becoming commonplace in rural hospitals because patients are forced to wait 16 to 20 hours in the ER for a family member to get care, only to be told to wait. Will it be even longer due to staffing shortages and overcrowding? Klein warns their anger and pain will be directed at frontline workers. Klein's union has spent years pushing for safe staffing and stopping workplace violence to protect nurses and CNAs from unsafe working conditions, but they're bracing for cuts. First people on the chopping block are not going to be the upper administration. It's going to be the ones who are doing the day-to-day work. Klein says for time for voters and healthcare unions to get loud, educated, and protective. Nurses are coming together to help rural communities get their paperwork, medical history documentation, emergency preparedness plans together for when hospitals begin closing. We can't fight for our own health if we can't fight for our own health, if we are not expanding all of our energy fighting everywhere else, says Klein. Our healthcare workers deserve to feel safe and protected. They deserve to feel valued. Instead, the new Trump GOP budget actively neglects patients, healthcare workers, in service of profits and partisan politics and agendas. Oregon Wellness Program in the news. This actually looks like a really good program, but this is from May 9th of 2022. They want people to know that the stigma of needing to hide from mental health issues must be addressed now. You are sweating, you're feeling restless, tense, irritable. You notice that your heartbeat has sped up. You are stressed and the precipice of breaking point, but you are not alone. With May being Mental Health Month, Awareness Month, the ADA is ramping up its effects to show members, member dentists that the association and the profession is committed not only to helping dentists facing overwhelming stress, anxiety, but supporting their members' wellness, patient care is never compromised. And while dentists are taking care of their mouths, we need to take care of their mental health. And this allows us to take care of others. Now, more than ever, the professionalism must prioritize the mental health of all dentists so that they can provide the best oral health care to their communities, said ADA President Cesar Sarbre- Sarbates. DDS. Mental health is a vital part of health and happiness and overall well being to everyone. Okay, this article I'm going to read to you part of you comes from the Allen Press, the Journal of Medical Regulation. Like many of us healthcare workers, physicians do experience substantial occupational stress, but are often reluctant to reach out for mental health assistance. Physicians and nurse practitioners often work when it seeking mental health services for distress is perceived as a stigma. Healthcare professionals fear being reported to credentialing committee or medical licensing board and risk loss of the practice status and opportunities for advancement. Seeking help may be perceived as labeling one as weak and not committed and not meeting historical professional bars. These perceptions are very likely learned as a precept of the culture from early training. In 2020 surveying the National Physicians Association, physicians experienced emotional distress, but 30% felt hopeless. 8% entertained self harm. 22% knew a physician who died by suicide. However, only a mere 13% sought help for mental health care problems. That is a really big problem that we have to get out of the community. I went through COVID. I went through and had COVID. I was working on a COVID wing where sometimes at my former facility, and I think I had we believe the record amount of patients I had at my facility was around 40. It was just one nurse and me, just a nurse and I working together. Okay, so I'm back to the article for a little bit. This is another interesting excerpt. The acquisition of mental health services is an important connection, conversation, cornerstone actually of mitigating those emotional consequences. The narrative serves as an expanded version of the Oregon Wellness Program, as reported by divers. Specifically, this article includes of evaluative component of both client users, mental health professionals, and adding important dimensions, suffering and sight, to understand factors some experiencing to us, influencing client stress, changes that they made to better their situations.
It's a scenario where being short staffed could have deadly consequences. But why are Oregon hospitals struggling to keep nurses on the job?
Investigative reporter Adrian Thomas has more on the problem that many say has grown worse in recent years.
Top nurse advocacy groups say Oregon has more nurses than ever before, but the rate at which these nurses are leaving their jobs is also at an all-time high. We get a first-hand look at the impact of this trend, sitting down with two former emergency room healthcare workers who wanted to make a change after the toll COVID-19 took on them and their colleagues.
And we never healed from that. They just give you a pizza party and say it's time to move on. Like, COVID's over, here we go. Yeah. And it's like nobody gave us an opportunity to heal.
For registered nurse Heather Sweeney and therapist Amy Ponteri, taking care of those who take care of us in emergencies has become their mission. It began several years ago when both felt there just weren't enough resources for those who work in the most intense healthcare settings like emergency rooms, and they know from personal experience.
There's got to be a better way to do this. Like, we've got to figure out a way for us to take care of ourselves better, for us to take care of each other better so we can sustain, because we're just dropping right and left.
Both shared stories of working in ERs during the pandemic and its aftermath, describing the emotional and physical toll it took.
And then you get all these text messages every day of open shifts, and you feel like you should go pick it up because you don't want to leave your teammate down, but then all of a sudden you work 60 hours in the week.
While they acknowledge some hospitals and healthcare groups provide employee assistance programs to address the mental health strain on healthcare workers, the two felt more needed to be done and started Helping Healthcare Heal, where Sweeney and Pontieri offer retreats, support groups, and even continuing education for healthcare workers. We caught up with some of the nurses who take part in the activities. They described the experience as eye-opening and rejuvenating.
I realized I had time to process some really intense things that I've gone through in the last year or two that I had not had time to do. And that I needed, there were so many tears.
It was just like something new happened to me inside myself. And just being with the other women, hearing their stories, learning from the ladies, and just came back empowered.
According to the Oregon Center for Nursing, Oregon has more licensed nurses than ever before, but 30% of new nurses leave their first jobs out of nursing school within their first year. Christy Simila is the director of professional practice at the union representing many Oregon nurses, the Oregon Nurses Association. Simila is also a registered nurse with over a decade of experience prior to her current role.
My belief is that in Oregon, we don't actually have a nursing shortage. What we have is a vacancy crisis. And that's because of persistent, unhealthy work environment, increased stress, increased workplace violence.
Simila says in her experience, many nurses are